Obsessive-compulsive disorder treatment. Obsessive-compulsive disorder, OCD, is a common mental disorder that causes a recurring state of uncontrollable obsessions and actions, in the form of unwanted thoughts, images, or urges that provoke stress and distressing feelings. The person, therefore, engages in behaviors aimed at getting rid of this obsessive, and these behaviors consume a lot of his time because he has to do them over and over again, and thus negatively affect the nature of his life and daily activities, and we will talk in this article about the treatment of obsessive-coffee. Obsessive-compulsive disorder treatment. An effective treatment plan for obsessive-compulsive disorder includes the use of drug or psychological treatment, or both. Despite the effectiveness of treatment and the response of most patients, some may continue to have symptoms, especially if there are other psychological disorders, such as depression and anxiety, which requires that these disorders be taken into account when choosing treatment, and after receiving appropriate treatment, there is an improvement in the quality of life of patients and an increase in their productivity during work or study, as well as their social relationships and enjoyment of daily activities improve, and the following will explain the treatment of obsessive-compulsive disorder in detail. Psychotherapy. Psychotherapy is one of the effective and scientifically authorized treatments for obsessive-compulsive disorder, which has been shown to be effective in reducing the severity of symptoms and their recurrence upon completion of treatment in full. The need to correct them with out-of-control behaviors. Psychotherapy for OCD includes cognitive behavioral therapy, CBT, which in turn includes a behavioral therapy called exposure and response prevention, ERP. How is behavioral therapy? During the behavioral therapy sessions, the patient is exposed to situations or images that focus on his fearful obsessions, and thus increase his tension at first, and then he is asked to avoid performing his usual compulsive or obsessive behaviors by continuing the situation without anything frightening happening to him, and thus the patient learns that these compulsions are just thoughts and are not related to reality, and thus he realizes that the compulsive behaviors that he needed to practice to overcome his anxiety have become unnecessary, and his stress decreases with time, and a treatment plan is usually developed that includes a gradual transition in the exposure stage of situations. Causes of concern are reduced to less worrisome, and are shared by therapists and patients themselves. Drug therapy. The doctor may prescribe some medications that help restore the balance of chemicals in the brain, the most important of which are antidepressants called selective serotonin reuptake inhibitors, SSRIs, which contribute to controlling symptoms of the disease, so that it reduces obsessions and compulsions, and the patient must be told that failing to improve, it needs 2 to 4 months from the start of treatment, since these medicines need time to start noticing their effect. Examples of these medicines, which are commonly used: escitalopram or Lexapro, fluvoxamine or Luvox, in English, fluvoxamine, paroxetine or Paxil, fluoxetine or Prozac, sertraline or Zoloft, in English, sertraline. If these medications alone are not responded to, antipsychotic medications are used, such as risperidone, aripiprazole or aripiprazole. Other treatments. There are other options that can be used in case of resistance to treatment and the inability of psychological and pharmacological treatments alone to control the symptoms of OCD. These options include intensive outpatient programs. These are comprehensive treatment programs that usually last for weeks and are based on principles of behavioral therapy, EPR, that benefit people with symptoms that are too severe to lead a normal life. Deep brain stimulation, where electrodes are implanted in specific areas of the brain to produce electrical impulses that may help regulate abnormal impulses, and this technique is approved by the U.S. Food and Drug Administration, FDA, for the treatment of obsessive-compulsive disorder in adults aged 18 years and over. They did not respond to conventional treatment. Transcranial magnetic stimulation, a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain with the aim of improving OCD symptoms. This process uses certain devices that have been approved by the U.S. Food and Drug Administration, FDA, to treat OCD in adults between the ages of 22 and 68. In general, when conventional treatments are ineffective,